Introduction. Esophagogastroduodenoscopy, also known as upper endoscopy, is a procedure performed to visually examine the upper part of your digestive system using an endoscope, a tiny camera attached to a flexible tube-like instrument, to diagnose and sometimes treat gastrointestinal or GI disorders. Indications. Investigation of symptoms. Your doctor may recommend an esophagogastroduodenoscopy to investigate any of the following symptoms, as they may be an indication of a serious medical condition: heartburn, abdominal discomfort or pain, nausea or vomiting, blood in the stools, unexplained weight loss, chronic stomach ulcer. Establishment of diagnosis. An esophagogastroduodenoscopy may be used to collect tissue samples from the digestive tract to test for conditions such as anemia or cancer. Treatment of GI disorders. Special tools can be passed through the endoscope to treat certain conditions such as removing a polyp or foreign object, widening a narrow esophagus, stopping bleeding from an injured blood vessel. Preparing for the procedure. You will be given specific instructions regarding preparation for the procedure. In general, you may be asked to stop eating or drinking anything about 4 to 8 hours before the procedure to ensure that your stomach is empty. Avoid taking any blood-thinning medications, as they may increase the risk of bleeding during the procedure. Arrange for someone to drive you home after the procedure. Esophagogastroduodenoscopy procedure. The esophagogastroduodenoscopy procedure involves the following steps. You will be asked to lie on a table on your side or back. Sedation medication will be given through a vein in your arm. An anesthetic medication will be sprayed into your mouth to numb your throat so the endoscope can be inserted. A mouthguard may be used to help keep your mouth open. The endoscope will be inserted through your mouth and down your throat. The tiny camera at the tip of the endoscope will transmit images to a monitor as it moves down your esophagus into the stomach and the upper part of the intestine, duodenum. Air may be released through the endoscope to inflate the digestive tract to allow free movement of the endoscope and for better examination of the folds within the digestive tract. Surgical tools may be passed through the endoscope to remove any polyps or abnormal tissue. Once the examination is complete, the endoscope will be slowly withdrawn out through the mouth. The entire procedure may be completed in 20 to 30 minutes. Post-procedure care. After the procedure, you will be taken to the recovery room, where you can be monitored while the effects of the sedative wear off. You may be allowed to leave an hour after the procedure. There may be slight difficulty swallowing, abdominal discomfort, and bloating, but these symptoms should go away in a day or two. Risks. Although an esophagogastroduodenoscopy is a very safe procedure, there is a minimal risk of reaction to the sedation medication, infection, bleeding. You should talk to your doctor regarding your specific risks before undergoing the procedure. Summary. An esophagogastroduodenoscopy is done to visually examine the inner lining of your esophagus, stomach, and duodenum for signs of disease